If you crack your neck, I recommend you stop. So when you crack your neck, you're actually manipulating the joints in between the vertebrae of your cervical spine in your neck. Now we have gases dissolved within these joints, and if you manipulate your neck in a certain way, you can release these gases and it will give the sound of a crack. Now for all intents and purposes, something like this is usually benign, but if you do it too excessively, it can actually create an injury to these two red structures over here called the vertebral arteries. So this is the front part of the neck and this is the back part of the neck. This is where the skull would be located, and this is where it meets the first cervical vertebra. We call this the occipito-cervical junction. And the idea is that if you crack your neck too hard, you could disrupt the inner lining of the artery, which could then be a nidus for a blood clot to form. Now, if a blood clot were to form in this artery, you could, in theory, completely cut off the circulation on that side. But we have another vertebral artery that can potentially compensate for the lack of blood flow here. More concerning, however, is if you form a blood clot that then dislodges and travels up to the brain, it can also create a stroke. Now, something like this is pretty rare, but that's why